everyone, I'm Anastasia. I welcome you all to this new session of Fundamental of Nursing. So in our previous session, as we have discussed about the physiology of sleep, the functions as well as the factors affecting sleep, in today's session we are going to discuss about a very small topic, which is the sleep disorders. So here these sleep disorders are mainly classified under three categories. The first one is the dysomnia, the second is the parasomnia, and the third is the disorders which is caused due to the other medical condition. So let us discuss about each one of it in detail. Now starting with the first one, which is the dysomnia. What do you mean by dysomnia? Dysomnia, we can say, is a name which is given to a group of sleep disorders which cause an individual an inability to sleep. So here this dysomnia is simply a name which is given to a group of sleep disorders which can lead one to have inability sleeping pattern. So from here we can understand whenever we say that a client is having dysomnia, it doesn't mean that he or she cannot sleep, but it simply means that he or she will not be able to sleep very peacefully. So here the sleep itself is pretty normal, but what is the difference is that the client may sleep too little, they may sleep too much, or even at the wrong time. So here, as we all know that we human beings mostly sleep at the night time, right? So here what happens to these clients who are having dysomnia is that they will sleep, of course, but their sleeping pattern will not be the same as of the others. And also here sometimes these clients may sleep too little, that is in a day they may sleep only for 2 to 3 or 2 to 4 hours, whereas sometimes they may even sleep too much or even at the wrong time. So what is the main problem here? The main problem here is the time, the amount, as well as the quality of sleep which the client will be getting. So as I have said that this dysomnia is a name which is given by a group of sleeping disorders, right? Which will cause the client inability to sleep. So what are these disorders? So here the common dysomnia are as follows. The first one is the insomnia. What do we mean by insomnia? Insomnia is a sleep disorder in which the client will be having difficulty or will be having a trouble in staying or falling asleep. So here the client will not be having a peaceful sleep. Why? Because he will not be able to fall asleep, or even if he is asleep, he will be having a trouble in staying asleep, which means that he will not be able to sleep continuously for a long duration of hours, but he will wake up in between. And the second one is the hypersomnia. So this hypersomnia is a condition in which the client may feel excessive sleepiness during the day. So here normally we human beings, we feel sleepy during the night, right? But these clients who are having hypersomnia, what they will be feeling is that they will feel excessive sleepiness during the day as compared to the nighttime. And the third one is the narcolepsy. So this narcolepsy is a neurological disorder that will affect the brain ability of the client to control their sleep and wakefulness. And the fourth one is the sleep apnea. This sleep apnea is a type of sleep-related breathing disorder which is characterized by abnormal breathing pattern when a client is sleeping. So what happens here is that if a client is also sleeping, then he or she will be having an abnormal breathing pattern, and this will also affect their sleep, right? So if you encounter any client who has an abnormal breathing pattern whenever they are sleeping, then this can be termed as sleep apnea. And the last one is the insufficient sleep or sleep deprivation. So these are the few of the conditions which you will encounter in the client who is having dysomnia. Now moving on to the second category, that is the parasomnia. This is a sleep disorder that involves any unusual or any undesirable physical events or experiences that will disrupt the sleep of an individual, and it can occur before, during sleeping, or even during the arousal from sleep. So here whenever a client feels that there is something abnormal that is occurring whenever he is about to sleep, or whenever he is sleeping, or even when he is arousing from sleep, then this is a sleeping disorder which is known as parasomnia. So as in dysomnia, as we have seen that a client under dysomnia will be having a problem in the quality, in the amount, as well as in the time of sleep. Whereas if a client is having parasomnia, then the quality, the amount, as well as the time of sleep will be normal. So here, even though if something unusual or abnormal is occurring to the client when he or she is asleep, however, the quality, the amount, as well of the time of their sleep are essentially normal. So here the most common disorders which you will be encountering in a client having parasomnia are as follows. The first one is the bruxism, which means excessive grinding of teeth or clenching of jaw. The second one is enuresis, which means bedwetting. The third is periodic limb movement disorder. The fourth is sleepwalking, and the fifth is sleep talking. So here, as I've said, that if a client is having parasomnia, there will be something abnormal which can occur to them before, during, or even when they are waking up from sleep. So these are some of the conditions which can happen to them while they are sleeping or even when they are getting up from sleep. And moving on to the third category, which is the disorders which is caused due to the medical condition. These disorders are usually associated with medical, psychiatric, or any other illnesses. So here, usually the disorders which can cause these sleep disturbances includes the depression, alcoholism, thyroid dysfunction, peptic ulcer, as well as COPD, which stands for chronic obstructive pulmonary disorder. So here under the third category, as it has clearly mentioned that these are the sleeping disorders which can be caused because of any other medical conditions, right? So these conditions can either be a medical or a psychiatric or even any other illnesses which the client may be having. However, this is usually common in clients who are under depression, who are an alcoholic, who have any thyroid dysfunction, peptic ulcer, or even chronic obstructive pulmonary disease. So since we have discussed about the three categories of sleep disorder, now let's move on to the nursing intervention. Here we will be discussing about what are the various steps we can do in order to help client promote their sleep. The first one is the sleep-wake pattern. So here what we must do is that we must encourage the client to maintain a regular bedtime as well as a wake-up schedule. That is, we must tell them to make a schedule whereby they will be noting down what time they need to go to bed as well as what time they need to get up every single day. We should also encourage them to eliminate the daytime naps, and even if they sleep during the daytime, then we must encourage them to limit it to 20 minutes or even less than that, and this should only be done twice a day. We must also instruct the client that they need to go to bed whenever they feel sleepy, because that is the time where they will be able to sleep comfortably as well as peacefully. We can also provide warm bath to them so that they fall asleep, as well as we can provide various relaxation technique. And even if the client goes to bed but he or she is not able to sleep in 15 to 13 minutes, then we can advise them to get out of bed and perform various relaxation activity instead. We must also instruct them to establish a relaxing regular bedside routine before they go to sleep, such as reading, listening to soft music, taking a warm bath, or doing any other quiet activities. We must also advise them to avoid doing any office work or dealing with any family problems before bedtime. We must also instruct them to get adequate exercise during the daytime in order to avoid stress, but must also inform them that they need to avoid performing any excessive physical exertion at least 3 hours before they go to bed. So this is one of the way through which you can promote your sleep, that is the sleep-wake pattern. Now moving on to the second one, which is the environment. So here, as a nurse, in order to help the client promote sleep in the hospital especially, what we must do is that we must create a sleep conductive conductive environment which is dark, quiet, comfortable, as well as at a temperature which is acceptable for the client. We must try our best to keep that particular environment noise free, and we must try to block any extraneous noise with white noise from a fan or even from an air conditioner. We must also provide them comfortable mattress as well as extra pillow to enhance their comfort, as well as advise them to listen to some relaxing music before they go off to sleep. And the third one is the diet. So here what you must do is that you must advise the client to limit the intake of alcohol, caffeine or nicotine in late afternoon and evenings. They must also consume carbohydrate or even milk as a light snack before their bedtime. We must also advise the client to avoid having heavy and spicy food in the evenings or even during the nighttime, because this can cause gastrointestinal upset which can disturb their sleep. And we must also advise them to decrease their intake of fluid 2 to 4 hours before they go to sleep. Now moving on to the next, which is the medication. So here first what we must do is that we must try our best to help the client promote their sleep by providing a good environment, by providing a good diet, as well as by telling them to follow the sleep-wake pattern. However, if this is not helpful, then at the end, you can provide them with the sleeping medications. However, here we must make sure that we advise the client to minimize the usage of medicine as much as possible, because many medications contain antihistamine which can cause daytime drowsiness. And if the client is having any pain that may disturb their sleep, then we can also advise them to take analgesic at least 30 minutes before they go off to bed. However, here you must also make sure that you advise the client that they always need to consult the physician or any healthcare provider about adjusting their medications, because this can cause insomnia. So these are the various methods that a nurse can do in order to help the client promote their sleep. That is, they advise the client to follow the sleep-wake pattern. They can provide a good environment, a noise-free environment, as well as a comfortable environment for the client. They can advise the client to take a proper food, as well as instruct them about limiting the intake of narcotics, of alcohol, of caffeine, and even of liquids 2 to 4 hours before they go to bed. As well as, if these are not helping, you can also provide them some sleeping medications, but this must be done only by the orders of the physician. But here is very important that you must also educate them about the side effects of these medication, as well as how to minimize the usage of these medication as much as possible, because this can also lead to certain other complications. And if a client is under these medications, she should make sure that she consult the other healthcare providers and tell them about this, so that they can adjust the other medications that he or she need to take, because this can also cause insomnia. So now here we have come to the end of this topic. So in today's session, we have discussed about a very small topic, which is the sleep disorders. So we've come to know that these sleep disorders are usually divided under 3 categories. The first one is the dysomnia, the second is the parasomnia, and the third are the disorders which is caused due to any other medical condition. And we have also discussed about what are the various steps a nurse can do in order to help the client promote their health. So I hope you have got a clear insight of this topic. I'll be meeting you guys in another session. Until then, have a good day. Thank you.